There are a couple of immediate changes in anatomy that occur once a baby is born. Remember, a fetus does not breathe. There is no air in the womb. So there are changes that occur once they're born and they start breathing. So before we get into the changes, let's review what you learned back in Chapter 19 about the basic flow of blood through the body. So remember here we have the right atrium and the right ventricle. So you have deoxygenated blood from the body goes into the right side of the heart. It enters the right atrium and it passes from the right atrium into the right ventricle. Then the right ventricle pumps that blood to the lungs. And remember, it's going to go through the pulmonary trunk and the pulmonary arteries to get there. Then that blood picks up oxygen. Now we have oxygenated blood goes to the left side of the heart. It's going to go to the left atrium and then the left ventricle. And the left ventricle pumps that blood into the aorta. And then that blood is distributed to the body. So anyone who's been born and is breathing is doing this system. Deoxygenated blood goes to the right side of the heart. It pumps it to the lungs. It gets oxygen, comes back to the left side of the heart, which pumps it to the body. Now we can look at that same setup, but in a fetus. So in a fetus, there's no point in sending blood to the lungs. See, it says deflated lungs. A fetus is getting oxygen from the placenta, so they don't use their lungs yet. So you have to bypass sending blood through the pulmonary circuit to the lungs. So there are two structures that bypass the pulmonary circuit. The first one is the foramen ovale. So you can see that here. This is a hole between the right and left atria. So here's the right atrium, here's the left atrium. You can see blood from the inferior and superior vena cava go into the right atrium, but then instead of going to the right ventricle, it passes through that hole straight to the left atrium. The other structure is the ductus arteriosus. This structure connects the pulmonary trunk to the aorta. So this is the pulmonary trunk. Here's the aorta. So quite a bit of the blood will pass from the right atrium through the foramen ovale to the left atrium. Some of it will come down into the right ventricle. The right ventricle will pump it up into the pulmonary trunk, but from there, instead of going to the lungs, it goes through this special vessel, the ductus arteriosus, straight into the aorta. So those are the two ways that you bypass the lungs and avoid the pulmonary circuit while you're getting oxygen from the placenta. And when a baby is born, on the first breath, so that very first breath they take after they're born, that foramen ovale closes. You have this flap here, this flap closes and closes that off. And then the ductus arteriosus will work on disintegrating over the next few days. Every now and then you hear about a baby with a hole in the heart. That usually means that the foramen ovale didn't close. And doctors can tell, they can hear the sound of the way the blood flows when that didn't close. So then they monitor it. It will usually close on its own within a few weeks. If it doesn't close on its own in a few weeks, then they can do surgery to close it. But in most cases, they just monitor it and it does eventually close up. Another thing that's different is the type of red blood cells. Remember, red blood cells pick up oxygen from the air in your lungs. But in a fetus, they're different. They have to pick up oxygen from the placenta. So fetuses have a different type of red blood cell. Fetal red blood cells are specialized for working with the placenta. Once they're born, then they have to get oxygen from the air. So they have to replace their red blood cells. And these are called adult red blood cells. So even though it's a newborn baby, there's still adult red blood cells that get oxygen from the air. So this means that a newborn has a lot of dead red blood cells. Because all those fetal red blood cells die. And remember, when red blood cells die, you get bilirubin. So we covered this in chapter 18. If you don't remember this, flip back to chapter 18. There's a whole page about red blood cells go to the spleen, they die, they're broken down, the heme is converted to bilirubin. Then the bilirubin goes into the blood, and the liver filters it out and puts it in the bile. It's pretty common for babies to get jaundice. Newborn jaundice occurs because there is so much bilirubin that it can overwhelm the liver. And the liver just can't keep up, and so the bilirubin builds up in the blood. The good news is there's easy treatment for this. UV light is the treatment. It will break down that bilirubin. So if it's summertime and a baby has this, you can just go outside and sit in the sun. If the weather is not cooperating, they have these incubators with UV lights. So here's an incubator with the UV light. Or now they even have blankets with UV lights. And you can just wrap the baby up in this blanket, and that UV will penetrate through the skin and break down the bilirubin. So there's a couple of things that are special to a fetus since they're not breathing, and that change once they're born and they are breathing.